Welcome to the Tip Jar. I'm cancer rehab specialist, Dr. Leslie Waltke. Here are some high-level tips for your patients exercising during chemotherapy. Here's the case. Your 10 o'clock new eval, Mr. Smith, is a 62-year-old male diagnosed with prostate cancer starting on Taxotere in several days. An absolutely normal scenario would be that after you meet and examine him, you determine he is otherwise healthy, has no musculoskeletal problems or issues, and you learn he already exercises regularly. And at that first visit, you teach him how to assess, progress, and scale back his exercise routine depending on how his body handles the chemotherapy. He says, I can do that. And you agree he is fully competent in modifying his exercise prescription on his own. So it's completely okay in that case to then ask him to follow up with you in 3 to 6 months, either by phone or in the PT clinic. He should, though, call you sooner if he is not hitting his 150-minute-a-week target, either because he can't or because he just isn't doing it. Get him back into the clinic so you can see, revamp his program, or help with whatever barriers are keeping him from exercising. Another very common scenario for your new eval is Mr. Smith comes in to see you for a PT consult before he starts chemotherapy, and you learn he's overweight, hasn't exercised in years, doesn't really like to exercise, has a history of knee and back pain, has no access to equipment, and of course it's the middle of winter. In this case, it is absolutely okay to create a very basic exercise prescription he can do at home for the next 7 days, and then bring him back into the clinic to progress the exercise prescription for the next week. You can repeat this weekly or every 2 to 3 weeks until he is independent and compliant. Now, global tips for your patients exercising on chemotherapy. The general exercise target is 150 minutes per week of moderate level exercise. Their exercise plan should include both aerobic and strength exercise. Add balance exercise if the patient is on a neuropathy-inducing agent. Get them exercising as soon as possible, ideally before chemo even starts, especially for people who don't exercise regularly or don't know how to exercise. Make sure whatever the patient is doing feels good to them and is accessible to them to maximize their compliance. Make it so simple they can't fail. Let them know something is always better than nothing, and walking in blue jeans or lifting weights in the living room are just fine. Teach them that exercise isn't going to make everything perfect during chemotherapy, but it will most certainly minimize loss, maximize function, and provide a much quicker trajectory back to good health. Those are all really good things to hold on to during a really rough time. Thanks for joining me for this episode of the Tip Jar. I'm Dr. Leslie Waltke. Thank you for making the world a better place for people with cancer. Have a great rest of your day in the clinic.